This digital billboard rolled through the Central Coast, delivering a blunt message. Union member and hospitality worker Vicky Silva wants people to take notice. She's battling cancer, and the bills are piling up.
To be honest with you, I don't even open the envelopes anymore. When I get the bills, I just throw them away, because I know that I'm never, ever going to be able to pay for them. We're all suffering from it. We're all living it. It's an everyday experience, you know. And so now OCA really knows that there's a problem here.
She's talking about OCA, the State Office of Healthcare Affordability. It's a relatively new board tasked with reining in high healthcare costs across the state, and now zeroing in on Monterey County hospitals, bringing the show to the Central Coast on Wednesday.
This is a huge deal. This board has never traveled and does not have plans to travel, to my knowledge, to any other part of the state. So the fact that they have decided to come to Monterey County to see for themselves what the situation is here, and to hear from folks who can't make the 6-hour round trip to Sacramento, is a very big deal.
At issue, high hospital rates, some of the highest in the country. In the past, hospital administrators have cited several factors, including an expensive place to do business and a high number of Medicare and Medi-Cal patients.
Specifically, it's a high cost of living for sure, first and foremost. And when we recruit and retain our staff here, we pay them at high wages.
Our mission, our obligation is to provide that care to everyone in the community. And unfortunately, because of the way government reimbursement works, that burden is shared by commercial payers.
Activists, though, reject those explanations, pointing to other high-cost areas where the rates are much lower. One OCA board member says the high costs are taking a toll, especially on the working poor.
People who are struggling to pay down tens of thousands of dollars in medical debt, foregoing opportunities for their children, sometimes foregoing food on the table. It's not something that should be happening here or anywhere.
And workers like Vicky, they say they're just grateful for the opportunity to tell their stories, hoping it will make a difference.
I'm just glad that OCA is making the time to come here.
So that OCA board meeting happens tomorrow at the Embassy Suites in Seaside. They have already instituted a phased-in 5-year plan to cap future spending across the state, but they could go further and institute a so-called sector target focusing specifically on Monterey County hospitals.